Sing of the Pambansang Awit ng Pilipinas, followed by a doxology by James Warren Ahero.
Bayang magiliw, perlas ng silangan, nananap ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyag ka ng magiging, sa manlulupig, di ka pasisili. Sa dagat at bundok, sa simoy at sa langit mabaha, may nilagang tulad, awit sa paglayang minamahal. Pag-islap ng matawat mo'y tagumpay na nanininig, ang bituin na tara niya, kailan pang mali magdidilim. Lupa ng harangan, bakit pagsinta mo'y langit sa piling mo? Aming ligaya na pamay mga pirang mamatay ng dahil sa'yo.
Bakit kaya? Bakit ka ba naghihintay? Nahimukin pa, pilitin ka ng tadhana. Alam mo na kung bakit nagkakaganyan. Lumulutang, nasasayang ang buhay mo, at ang ibinubulong ng iyong puso. Natutulog ba ang Diyos? Natutulog ba? At ikaw ay kaagad sumusuko. Kunting hirap at kunting pagsubok lamang. Bakit ganyan? Nasaan ang iyong tapang? Naduduwag, nawawalan ng pag-asa, at iniisip na natutulog pa. Natutulog ba ang Diyos? Natutulog ba? Sikapin mo, pilitin mo, tibayan ang iyong puso. Tanging ikaw ang huhubog sa iyong bukas. Huwag mo sanang akalain natutulog pa ang Diyos. Ang buhay mo ay mayroong halaga sa Kanya.
Project Pro-CARI, providing clear and reliable information about healthcare in this time of the pandemic. Good day, everyone! It is with great pleasure to welcome you all to this 8-day webinar of Project Pro-CARI. I am Renchan Dos Armenta, today's webinar facilitator. Project Pro-CARI is an 8-day webinar starting March 6 up to April 24 every Saturday. In line with their civic welfare training service subject, the proponent came up with a said project to offer transparent and accurate healthcare information, to be able to clarify how harmful the lack of awareness in healthcare is, and for the community to apply as a good healthy individual. This is timely and relevant now that we are facing a global pandemic. With that being said, may the webinar series successfully provide information about healthcare. And now, our fifth webinar for today is an organization organized exclusively for charitable, educational, literary, and scientific purposes to advance the art and science of planning and the activity of planning, physical, economic, and social, at the local, regional, state, and national levels. And today, they will present us what a healthy community is. Without any further delay, I am now handing it over to American Planning Association, together with Miss Amanda Wigner and Miss Allison Hastings.
Well, thanks very much to the APA for inviting us to speak. We're really excited to talk more about Get Healthy Philly, and I'm excited to get to co-present with Allison, my previous coworker and current collaborator, and Clint, my current coworker. So I'm going to talk a little bit about Get Healthy Philly more broadly and the work that the Philadelphia Department of Public Health is doing around obesity prevention, chronic disease prevention through healthy food access. So I'm going to give intro to Get Healthy Philly, talk about some of our key strategies in our food access mapping, and then Clint's going to talk in more detail about the planning policy work that he's been involved in. So Get Healthy Philly is an initiative that's funded through the Communities Putting Prevention to Work program, the federal program through the Centers for Disease Control and Prevention. So Philadelphia got awarded a $25 million grant in March of 2010 to do this work, and it's $15 million towards obesity prevention and then $10 million towards tobacco. And the obesity prevention work is focused on both healthy eating and active living. So there's two components to it. So I'm going to talk first just about the challenges of obesity and why we felt that this work was really important. So to start, so this is one of the challenges. This is the KFC Double Down sandwich, and it's 2 fried chicken patties as the bun with bacon and cheese on the inside. So this weighs, this has 540 calories, 32 grams of fat, and 1,380 milligrams of sodium. And they also offer a healthier grilled version, but that is just as bad and has mysteriously more sodium with 1,430. So this is just, some of the things that people are up against and some of the things that make it hard to have healthy behaviors. And this is another thing. Food marketing of unhealthy foods is available everywhere, disproportionately available in some neighborhoods, and the amount of money spent on food marketing of unhealthy food is, hundreds of times more than public health marketing for healthy eating and active living. And this is a corner store, not necessarily in Philadelphia, but there was a survey of inner city children in Philadelphia corner stores, and it showed that elementary school kids often buy chips, candy, sugary drinks twice a day, which adds an extra 3,500 calories a week to their diets. So for $1, a child can buy 360 calories of food and beverages. And they can buy an 8-ounce beverage, a single serving, a bag of chips, an assortment of candy and gum, and a popsicle, all for $1. So that's something else we're up against. And then just to briefly mention the physical activity, active living side, because it is a large component of the work as well. There's auto-based planning, as I'm sure people on this call know just as well as I do, that makes it hard for people to walk and bike and use active public transit, even if they want to. There's some challenges in the physical environment that we need to address. So this is just a summary of some of the things I just said, the key determinants of obesity: poor diet, limited access to healthy foods, aggressive marketing of unhealthy foods, higher relative price of healthy foods compared to that $1 that you can get all those things at the corner store, and then lack of physical activity. And this is how it can play out on the ground in Philadelphia. This shows just adult obesity and overweight. And for children, obesity and overweight, 46.9% of the children in Philadelphia are overweight or obese. So there's definite challenges that we're facing here. And poor diet and inactivity are the second leading cause of death for Philadelphians, and there's 22,000 deaths from those causes in Philadelphia since the year 2000. It's 2,000 deaths per year approximately, and about $750 million annually in healthcare costs. So, the reasons I just said: increased caloric intake, lack of fruit and vegetable consumption for a variety of reasons, including, access in terms of affordability, availability, and physical awareness and knowledge of how to get those resources. So, and obesity is not just a challenge in itself, it's more the risk that it poses for these other health outcomes, type 2 diabetes, hypertension, and other diet-related diseases. So, given all of that, how can we make it easier for people to engage in healthy behaviors? This is the model that we're using through Get Healthy Philly, which is trying to make it, to change the default option. Thomas Frieden from the CDC uses this, and we like this model a lot, thinking about making the healthy choice the easiest choice and the default choice that people have, so that it's easier for them to have access to this healthy, affordable food and to be active. And the way that we're approaching this is to work across many different departments within the city, work with as many external partners as we can in a variety of different ways. So these are different circles representing, the different components, but there's obviously a lot of overlap between built environment and community food access. Institutions such as schools and after school, and workplaces, and the media and policy, of course, is overarching all of those things. So in Get Healthy Philly, these are sort of the three themes that we're looking at. It's increasing access to healthy, affordable foods, decreasing the availability and consumption of unhealthy foods, so they sort of go hand in hand, and enhancing opportunities for safe physical activity. So I'm going to talk a couple minutes about the strategies for increasing access to affordable, healthy foods that are happening on the ground. So we've been working with the Food Trust on coming up with 10 new farmers markets that are in low-income communities. 4 were started in 2010, and then another 6 are planned for this year. And we're not only having these farmers markets created, we also started a Philly Food Bucks program, which is sort of like a double value program. So people can use their food stamps, their food benefits at the market, their SNAP access cards, and if they use, for every $5 they spend at the farmers market, they get an additional $2 coupon that you see here on the screen for fruits and vegetables specifically. So it's been a pretty popular program in the first year. It increased SNAP sales significantly, over 100%, and we're still trying to work on pushing that number more. And we're working with community partners to get the word out about the program and to connect it with nutrition education. So it's not just educating about food, it's also helping them increase their buying power so they can get it, and to connect them to the farmers market and make them know that they can use their food benefits there.
Amanda, sorry to interrupt. Can you just tell people what SNAP are?
Oh, sorry. The Supplemental Nutrition Assistance Program, which is formerly food stamps, so it's the federally funded program for lower income people to give them benefit cash per month to be used for the purchase of food. And it's called SNAP, and it's an access card. It's the actual electronic card that is almost like a credit or debit card. And through the work of the Food Trust and Farm to City and other groups in Philadelphia, a lot of the farmers markets in Philadelphia already have the capacity to accept food stamp or SNAP benefits at the markets. So that was a really great infrastructure that was already in place that could help with this program. So we're also working in a lot of corner stores, and I'm going to show you a map of the farmers markets and the corner stores in a moment so you can see their distribution across the city. But we're working with over 500 corner stores through the Food Trust and the Healthy Corner Store Initiative. So 500 are sort of at the first introductory level, so they're introducing at least 2 new products in 2 different product categories. And then there's going to be a smaller number of corner stores, up to 100 though, that will be able to have mini grants for infrastructure capacity, so like storage, like the refrigerated unit you can see here, so that they can be better able to provide fruits and vegetables and other healthier products like lower fat milk and whole grain bread products in the communities of need. And then we're also looking into a produce cart program similar to the New York City Green Carts that would be looking at the areas that that still have need and aren't currently being served by the farmers markets or corner stores, or could be connected with them in some new ways. And we're also thinking about ways to connect that to our health centers. So this is just a couple of the community food access components that we're working And just so you can see a map, we're lucky to have a geospatial analyst on staff who does really great mapping for us that I'm going to go into more detail about. And it's really helped to inform our decisions about where we should focus our efforts and also measure how we're doing. So on the left, you can see the total corner stores in Philadelphia, which is approximately 1,500. And on the right, you can see that over 500 are enrolled at that level of introducing new products. And then for the farmers markets, this shows all the farmers markets in the city that we know of at this point. And then if they're blue, they accept SNAP, the benefits I talked about earlier. If they have a dollar sign in them, they also accept the Philly food bucks. And the ones with the cross or the check behind them are the ones that we've created through this initiative. So this shows the 4 that were started last year, and I think 4 for this year, and then 2 are still to be determined, the locations. And we're hoping to also partner to locate these markets at a couple of them at transit hubs where possible, so that the access is greater. And then I just wanted to say really broadly, we're also, besides these on-the-ground community food access initiatives, we're also doing a big media campaign, and it's focused on making the connections between the consumption of sugary drinks, obesity, and the risk for diabetes, especially for younger children. So on the top left is a screenshot from the TV ad that we had, and the bottom right is from our transit ads. So we have on it in bus shelters, bus stations, on the subway, and there's a texting interactive component so that people could actually text in and get responses to different questions we had, or they can opt into an ongoing program where they can get more information about healthy drinking and eating. And on the right is we did a vending policy for the city, the vending machines within the city, to help tip the balance a little bit more towards healthier drinks. So water, 100% juice, and making portion size more right-sized. So if there's questions about that, I'm happy to answer either in Q&A or email, but I just wanted to mention those two as well. So what I'm really going to talk about in more detail is our food access mapping. And like I said, we have a geospatial analyst who's been doing a really great job trying to bring together all of this information. And Clint's going to talk more about how he's going to use it in his work as well. But I'll just walk you through the methodology. And it's still evolving. It's a process. But this will give you a sense of what we're thinking at this point. And as I said, it helps to inform our placement of the on-the-ground interventions, the corner stores, the farmers markets, helps to inform the planning and policy decisions, and it also will help us measure, the current need and our progress as we're going forward. So these are the 18 planning districts in the city of Philadelphia that were recently created. And I'm going to just walk you through the mapping looking at the lower north planning district. So this is a zoomed-in shot of the lower north planning district. So we took supermarket data from paid sources, and we mapped them. And all of these different food retail sources are going to have different points, and that's going to add up to the walkable food access score. We're focusing on walkability for this at this point because we want to see, because transportation and food access, if it takes a lot of time, or if you have to change bus lines, or if you have to get a car to get to a food retail establishment, that can increase the cost of food. So having healthy food in a walkable distance from you is effectively making it more affordable. So we're looking at supermarkets, and we gave them the highest score based on their diversity and assumption that they have a wide variety of products at a range of prices. We also assigned a walk shed to them of half a mile, because we assumed people would be able to would want to walk a half a mile to a good supermarket. And next is mid-sized, and supermarkets we defined as 2 million or more in sales. So mid-sized supermarkets is 1 million to 2 million in sales, and has a walk shed of a quarter mile, and it's 20 points. Corner stores, there's a couple different kinds of corner stores on this slide. There's chain convenience stores, which we determine based on their franchise code, and they're usually Wawa's, which is a local convenience store chain that has a large amount of food and deli, and 7-Elevens. And they have a walk shed of a quarter mile and 4 points. And then there's the corner stores in the Healthy Corner Stores network, and they have a watershed of 1/10 of a mile. So there's Healthy Corner Stores, which are 2 points, sorry, and then the that higher level conversion corner store that would get the infrastructure mini grant, they're 4 points. And the ones that are the different colors are the conversion stores. All of the corner stores on this, if they're not convenience stores, are in the Healthy Corner Store network, and the purple ones are the ones that have received grants. And then farmers markets have a relatively lower score based on seasonality and operating hours, but we're thinking about possibly, if it's a year-round market, changing the score. So as I said, the scores are in flux right now, but currently they're 2 points and a watershed of 1/4 mile. And the one with the square around it is one of the ones that we started through Get Healthy Philly. And then we're also looking at produce carts. So these aren't the produce carts that have been started yet through our initiative because that's still getting underway. They're ones that are currently licensed through the health department, through our environmental services division here. So then when you look at all of this together, you get the aggregate walkable food access score. So the green has the highest access score with over 50 points. Yellow is moderate, orange is low, and red is no walkable access. And when you take the low to no access, the red and the orange, and overlay it with areas of higher poverty, then you get the target areas. And high poverty for this purpose means 60% or more of the households in a particular area are below 200% of the federal poverty line. So this is what it looks like at a citywide level. And as I said before, this mapping is used when we choose the farmers markets, the corner stores, the healthy carts, and when we're thinking more broadly about policies and planning.
Well, thanks for having me. I'm really excited to be talking about our work here. And again, we're the Delaware Valley Regional Planning Commission. We're based in Philadelphia. And I just want to give out a shout out to Amanda Wagner, who's also presenting on this call because she worked with DVRPC a lot on these projects that I'll be talking about a little bit today. So first, an overview of who DVRPC is. We're Philadelphia's metropolitan planning organization, and we serve parts of 2 states, southern New Jersey and southeastern PA. And we prioritize transportation funding, as most MPOs do. That's our traditional role. And we serve about 5.5 million people who live in greater Philadelphia. And again, our issue areas are transportation, land use, the economy, and the environment. So and here's a map of I guess the northeast corridor, and DVRPC service area is that yellow area, and some other metropolitan planning organizations or regional planning agencies are right around us. So you can see kind of how Greater Philadelphia fits into the northeast. So a lot of questions that I get are about why does an MPO, a metropolitan planning organization that focuses on transportation funding, care about the food system? And we think that it cuts across all of our issue areas, and I'll go very briefly into that. So this is a map of Greater Philadelphia's rail or freight corridors, our multimodal freight corridors. The blue line is our east-west connection along 76, I-76, the Schuylkill Expressway, and that yellow is the north-south connection along I-95, New Jersey Turnpike. And these are really important freight corridors, and Greater Philadelphia has somewhat of a lower traffic congestion than other metro areas. So it's made our region a really large importer of food. And 14 million tons of food move through Greater Philadelphia each year approximately, and we serve New York City, Boston, as well as Baltimore, D.C. And then when it comes to land use, this region has started to we suburbanized later in the 1970s, 80s, 90s, and early 2000s. So we've seen a lot of agricultural land disappear, and we really need to think about the future of this region in a post-fossil fuel era, and that also includes where we're getting our food from. Then when it comes to the economy, Food is rather volatile, so as you can see, this chart is from the Consumer Price Index. Just in the last year, how prices have increased over time. And if you take out, the blue line shows all items in the Consumer Price Index, but that red line shows all items less food and energy, because food has increased more than all other items in the Consumer Price Index, and that's really because it's tied to energy prices. So we think that having a stronger regional food system might buffer Greater Philadelphia when it comes to price increases as it relates to fossil fuels. And then lastly, the environment, and that's where I am, and I'm an environmental planner at DVRPC. We think that food production really impacts the natural environment, and the built environment impacts the natural environment, and the environment impacts human health. So we think this is also an important issue that a metropolitan planning organization should be involved in. And this map shows what we're terming the 100-mile food shed around Philadelphia, and it shows all the agricultural soils. And the red is the agricultural soil that we have lost in really just the last 15 years, not that this isn't showing the last 60 years of development. It's showing the last 15 years of suburban development. Yet this area that's very dense, as it has an overlapping, food shed with New York City, Baltimore, D.C., 37% of this area is undeveloped and considered to be important agricultural soil. So we have a lot of great assets close to this, this dense metropolitan area. So moving forward, how did we structure our food system planning process? We decided to do our food system planning process in 2 years. And first, I think is really important for planners to hear is that we involved a lot of non-planners or non-traditional stakeholders to create our scope of work. And that really made our project a little bit different in that we were answering questions that experts in their own fields were asking, but they didn't necessarily have access to planning tools or data to answer those questions. We did intensive surveying that actually Amanda Wagner headed up, and that created a food system assessment that looks at ag resources, food freight, food economy, and social capital, like the human resources that are in the food shed. Then our second year, we decided to build on that food system assessment and identify values, aspirational goals, and indicators, identify far-reaching recommendations, then prioritize those recommendations, and then because DVRPC has a pretty strong relationship with one of our regional foundations, we created a financial assistance program to implement some of those top recommendations. So that was also a neat exercise because we got to make a plan that had some initial implementation funds associated with it. And here is a slide of just some of those stakeholder groups that worked with us on our food system planning projects. Some are leaders in food access, such as the Food Trust and Share Food programs. We had university partners like the University of Pennsylvania, Rutgers, Penn State, the 2 large land-grant universities. Others are leaders in local food and sustainable agriculture like Fair Food, PASA, the Pennsylvania Association for Sustainable Agriculture, and NOFA New Jersey, the Northeast Organic Farming Association, the New Jersey chapter. Government agencies, because we think they're really important in the food system, as well as land trusts, and then we also engaged the philanthropic community in and around Philadelphia. So again, we released our food system study in January 2010. And here's example analysis, again, looking at that 100-mile food shed. So beyond DVRPC's service area, we wanted to see, what were the food products that are being grown in and around Greater Philadelphia that could possibly serve Greater Philadelphia or go to Philadelphia. So this map shows USDA data looking at top commodity by production value. So which type of commodity is each county kind of specializing in? And that pinkish color that you see a lot is nursery, greenhouse, floriculture, and sod products, which also includes mushrooms and tomatoes under greenhouse production, but also includes a lot of floriculture, nursery items that you would find at Home Depot or a garden center. So we were really surprised to see quite a lot of non-food items being grown in the 100-mile food shed. But then we were also surprised to see a lot of animal agriculture happening in this dense area, including dairy, poultry, and eggs. That was surprising. And then that bright green that you see, or that darker green, is vegetables, which we thought we were going to see more of in the 100-mile food shed. So a question that we get asked a lot is, could the food shed grow enough food for Greater Philadelphia? And again, 5.5 million people live in Greater Philadelphia, and the short answer is no. The food shed could not grow enough for 5.5 million people, nor has it ever. The United States, pretty much every region, is not self-sufficient. So we knew going right off the bat that our food system planning is not about self-sufficiency. It's really about how can we have a food system that serves more people, serves people fairly, and creates economic wealth for our region. And so that's how we started building on what we learned in the food system study for our food system plan, knowing that we're not talking about self-sufficiency, we're talking about a more sustainable food system that embodies values. So we released this in February 2011. And we wanted to understand how we're going to organize this plan around values. So we did a lot of facilitated stakeholder committee meetings to ask people, like, what are we really talking about when we're talking about a sustainable food system? And so from those meetings, we heard that people want a food system that respects farming and sustainable agriculture, where food can be a tool for economic development, that the food system promotes health, that it's fair, that we have collaboration, and that our food system is ecologically sustainable, that there's ecological stewardship practiced. We also wanted to look at indicators to measure the progress of the plan over time, especially since we're a planning agency. We do not do a lot of implementation. So we wanted to have indicators that could measure other people's actions and see how a lot of individual or disparate efforts can be piled up to show big systems change or changes in the food system. So we identified 10 indicators, and here's an example of one indicator. This chart shows the amount of land and agricultural production in New Jersey. So as you can see, New Jersey's land and production decreased by 16% between 1997 and 2007. So, and New Jersey's lost over 20% of its cropland in the last 10 years, so that's significant. We also wanted to look at fairness in the food system. So this indicator here shows household food insecurity in New Jersey and PA, the whole states. And as you can see, it's also increased substantially since 2001. It increased by 38% in the number of households suffering from food insecurity. The next indicator here is the food sector employment in Greater Philadelphia. So this is just the 9 counties that make up Greater Philadelphia as DVRPC defines it. And as you can see, it's increased slightly, 4.4% between 2001 and 2008. And that's compared to 2.5% increase in the overall employment in this geographic area as well. And something that's interesting is that during this economic recession, food is the only real economic sector, the only economic sector that we've seen a big increase in. So it continues to grow, just though we're in this economic recession. So we had 52 recommendations, and we went through a very lengthy process of identifying those recommendations. We did like best practices from other regions, from other states, and we culled them down to about 100 recommendations and asked our stakeholders to identify their top. And so from there, we could kind of sift out 52 unique recommendations that really span recommendations that are really for the federal government, to municipalities, as well as those that should be undertaken by consumers, nonprofit organizations, institutions. So I'll just go through the top recommendations. One was to keep farmland affordable in a crowded and expensive region through a new range of business models like lease agreements. Another was to the committee, our stakeholder committee, because we were coming up with this plan during the economic recession, really didn't want to propose new programs that would require more federal funding, more government funding. So people wanted to see market-based solutions that protect natural resources. We also heard that schools are probably one of the best ways to establish long-term eating habits and healthy behaviors. And so our committee really felt strongly about farm-to-school programs, integrating farm-to-school programs in many different ways so that we're really establishing these long-term habits early on in someone's life. They also wanted to see food become more of a business development strategy that has living wages, which is something that the food system struggles with, is to have living wages. They want to see increased public awareness of healthy food through different programs and educational experiences. And then something that we were surprised about is that the stakeholder committee also wants to continue to meet on a regular basis to coordinate their activities and have an opportunity to hear about what's going on in the food system beyond their doors or what's happening in another area of the food system. So as I mentioned before, we had this opportunity to write our plan, Eating Here, at the same time that we have a technical and financial assistance program that's funded by the William Penn Foundation, and that's been a great opportunity. So we took those top 6 recommendations that I just went through, and we created a request for proposals, and we were able to ask different stakeholder committees or different organizations how they would implement one of our recommendations. So we have funded a couple startup projects or helped projects expand that are meeting those needs and recommendations in our plan. And then going forward, DVRPC is going to work with our member governments, who are municipalities and counties, to see what their unique role in the food system is. So here's an example of one of our implementation grants. This is the Pennsylvania Association for Sustainable Agriculture. They are creating a business venture designed to connect aspiring farmers and land. They describe the project as eBay meets eHarmony. That new farmers who are having a hard time accessing land because they're not coming from farming families. So they're not inheriting land. They might not know large landowners. They need access to land. And then there's a lot of landowners, some who are farmers who are retiring and don't have family members who are going into farming, or some people who just own land and would like to see it be farmed. This project is linking those farmers, but also providing business planning expertise and maybe some financing to help farmers, beginning farmers, get those farms started. And then here's another example of a grant that we made to the Greater Philadelphia Tourism Marketing Corporation. They're our big tourism marketing program in Philadelphia. And this was for them to start a local food tourism marketing campaign that's really about making Philadelphia known for being a local food destination or having these great artisan products that we have. So this is Philly Homegrown, and I suggest everyone go and visit it. It's a great, it shows how important and how beautiful I think the local food movement can be when it's marketed by savvy professionals. And then when we're thinking about how to work with our municipal and county government officials, we put together this municipal implementation tool brochure that we released last year that looks at kind of the unique things that municipalities could do. And we organized this brochure around, can a government encourage sustainable food production? How can they improve healthy food access? How can they support a local food economy? And so it's really unique actions that municipalities can take. And with that, I'm finished with my presentation.
Thank you so much, Miss Amanda Wigner and Miss Allison Hastings. Truly, American Planning Association exists to elevate and unite a diverse planning profession as it helps communities, their leaders, and residents which anticipate and meet the needs of a changing world. Thank you so much to those who participated in the 5th part of the Project Pro-CARI webinar series. The page is open for questions until 11 in the morning. Again, thank you and see you on the sixth part of the webinar next week.